Dear participants, community-driven organization representatives, civil society stakeholders, philanthropies, and global stakeholders, welcome to the launch of our research, Understanding the Barriers to Girls' School Return. These are the voices of the girls from the frontline of the COVID-19 pandemic in East Africa. It has been a journey, but we are both glad and honored to have reached the end and to have the privilege to tell the stories of the girls from the communities in East Africa. Too often, the girls' voices are left behind and are not included. It was important for us to humanize the statistics behind the barriers preventing girls from returning to school and to listen to the ideas of the girls and understand why we must urgently invest in holistic services to support them. But first, who is Amplify Girls? Take a look at the video below put together with the help of our partners from community-driven organizations. Welcome.
AMPLIFY Girls is a collective of community-driven organizations in Kenya, Uganda, Tanzania, and Rwanda. We are working to create new models of scale that amplify the voices and impact of community-driven organizations.
We do this in a structured three-pillar approach, supporting organizations to share best practices and learn from one another through intentional collaboration.
Documenting and communicating the impact of CDOs through rigorous, local-driven M&E and research, using Amplify collective power to advocate for global and local change, and driving resources for community-driven development.
AMPLIFY Girls has enabled Dandelion Africa, a grassroots organization, be part of a dedicated team working towards reimaging traditional development scale by mobilizing our collective voices and impact of our work to maximize the potential of adolescent girls.
We amplify the voices, work, and collaborative impact of local organizations focused on the power and potential of adolescent girls, and we envision a world where communities are leading global change.
A big welcome to everyone just joining us. We are thrilled to have you join us as we embark on sharing our work and research as Amplify Girls, supported by Echidna Giving. So you just got a brief introduction of who we are as an organization, but today is really about the research that we recently completed on how COVID-19 has impacted the education of adolescent girls. It is imperative to recognize that we must include girls in the conversation when it comes to their rights and what they hope to see for their futures. I would now like to introduce our formidable research team that led this research, Ms. Brenda Oulo, who was the principal investigator in this research, and Obrin Siddle, who was the co-investigator in this research, to join us in sharing the findings. Please find the link to the full report and the executive summary, if you don't already have it, in the chat box below.
Thank you, everybody, for joining us today to hear about the findings of the research that we completed with the Amplify Collective of CDOs in East Africa. With the onset of the pandemic last year and governments closing schools across countries in East Africa, emerging reports indicated rising levels of teenage pregnancies that threatened to curtail the education of girls. And with these reports emerging and various stakeholders reporting that the situation for girls on the ground was dire, Amplify and its partners embarked on research to hear the voices of girls specifically and on what challenges they were experiencing that might prevent them from going back to school when the were given. Now let's go into the specific findings of the research. So as I have mentioned, this research was undertaken by the Amplify Collective of CDOs who interviewed girls in their communities to find out their specific barriers to school return. So the key takeaways from our study were that pregnancy, which was a result of transactional sex, is the biggest driver of girls' dropout during the pandemic. The economic hardships underlying job losses and financial constraints that resulted from this forced girls to seek alternatives to meeting their basic needs. And the majority of girls reported engaging in transactional sex to meet basic needs. And the resulting unintentional pregnancies were a big challenge to school return for those who reported this barrier. And secondly, social stigma surrounding teen pregnancy and motherhood is the single biggest factor, keeping girls who fell pregnant from returning to school. And in countries where the policies are conducive and allow school return post-pregnancy, the social stigma from parents, teens, communities, teachers was a big hindrance to girls who had been pregnant to return to school. The study was a multi-country qualitative cross-sectional study that involved 4 countries, Kenya, Uganda, Rwanda, and Tanzania. And we spoke to 382 adolescent girls in total. These were done through 35 focus group discussions. These were conducted with girls who were planning to return to school. And we also conducted 108 in-depth interviews with girls who had been unable to return to school at the time of interviews. The data collected was transcribed, and the transcripts were coded using a semi-structured framework developed by the research team. And we conducted thematic analysis on the coded transcripts. The FGDs, data from the FGDs was mainly used to draw out and contextualize primary issues facing girls in the pandemic, but we also used the in-depth interviews to ground and verify issues that had been highlighted in the FGDs. So as we can see on this slide, the graphic shows the IDI respondents and their primary reason for dropping out of school. We see the largest majority of participants had dropped out because of pregnancy or had been recently pregnant, so they were young mothers. We also see a very large proportion had dropped out because of lack of school fees, and other reasons also found were marriage and employment. They were working at the time of the interview and had not found a reason to stop working. I will hand over now to the co-investigator, Obrin, to walk us through some of the primary pathways and specific barriers that we identified in this study.
Great. Thank you so much, Brenda. So as Brenda has mentioned, you'll see that our key finding is this primary pathway to girls dropout. This was the most common pathway found in our study, that the situations of economic hardship brought on by the pandemic were leading to transactional sex and unintended pregnancies and ultimately dropout from school. When we looked at our FGDs, the mentions and the mentions of 61% of the men reported transactional sex in exchange for basic needs goods like food, clothing, soap, and lotion. 19% of the mentions were transactional sex in exchange for menstrual hygiene supplies and primarily pads. 9% for school fees or luxury clothing items like nice dresses, and just 6% for phones and technology. When we talked to in-depth interviewees and girls who were pregnant, 29% of pregnant girls who gave us a reason for their pregnancies confirmed that transactional sex was the reason. So then when we look at the reasons girls are dropping out of school, understandably then the primary reason given by girls was the social stigma of pregnancy by peers and school communities. Other reasons included not being allowed to return to school in the case of Tanzanian participants, no supports for pregnant girls or mothers, no nutritional access for pregnant girls at schools, lactation support, and lack of childcare. And many reported just being gone too long to catch up. So we synthesized girls' barriers to school return into 5 categories or 5 types. The first being physical barriers to remote learning. These included unsupportive home learning environments, increasing chore burden for girls at home, and differential access to technology, especially for rural girls. Also relocation and displacement as girls moved from rural to urban areas and urban to rural in search of food and income. Secondly, economic barriers. Again, girls need to earn money and take care of their families. Many of these resulted from parental job and income loss. Many girls reported experiencing parental sickness or death, all of which led to increasing pressure for them to engage in child labor to meet the basic needs of their households. Third, health barriers, including pregnancy and early motherhood driven by sexual exploitation, as we have mentioned, but also reduced access to sexual and reproductive health care, information, and counseling. Many of the girls in our studies reported that school was the only source of sexual and reproductive health information for them. And so when schools closed, they were left without this education, counseling, and anyone to talk to about their sexual and reproductive health choices or care. Increased vulnerability of girls to both sexual and physical violence, and a notable amount of violence against pregnant girls was reported throughout our study population. Fourth, social barriers for pregnant girls, including community stigmatization of pregnancy and early motherhood, as well as toxic school and peer culture. And all of these barriers really compounded and led to what we're calling a set of personal barriers or psychosocial barriers. These included fears and attitudes linked to academic underperformance, stigmatization of pregnancy, and anxieties about the future, all of which serve to produce a loss of hope for girls about their ability to return to school. We try to capture this experience of sustained trauma here on this slide, where we see that all of the individual challenges and barriers that girls have mentioned are really serving to degrade girls' self-concept and contribute to a loss of hope about their futures. Household chore burden, stigmatization of pregnancy, unplanned pregnancies, violence, inadequate legal frameworks to support their school return, inability to access remote learning. All of these have really contributed to an experience of sustained trauma. So we wanted to, in our study, also ask girls what their recommendations were for how they could be supported. We see on the next slide a summary of girls' recommendations by type. We'll note that 54% of girls recommended some type of intervention that would support their economic needs or financial independence. This came in the form of vocational training and also broad requests for economic support in terms of school fees and food and other basic needs goods. 25% of the mentions from girls had to do with actions that would support pregnant girls and or prevent future pregnancies. So these include community sensitization, access to contraception and sexual and reproductive health information and services, childcare support for young mothers, and general harm reduction. And 18% of girls' recommendations were related to psychosocial support. Many of these were requests for counseling were related to encouraging girls to engage in remote learning and to return to school despite prolonged school closures. We synthesized girls' recommendations into 6 categories of action. The first, to provide immediately material resources to support girls and their families. These include basic goods, pads and food, but also school fees to support their school return. This is a basic requirement. Second, to provide or build pathways for pregnant girls and young mothers to continue their education. Recommendations from girls included making schools more girl-friendly, providing vocational training opportunities as an alternative pathway to school return, and broad economic empowerment programs that would support girls' education and financial independence. Third, psychosocial support for both pregnant and non-pregnant girls, counseling and mentoring to encourage girls and also to treat girls' experiences of trauma was frequently cited throughout the population. Four, interventions that affect social norms and policy change that will reduce the stigmatization of pregnancy and help raise awareness about pregnant girls' rights and needs. Five, effective sexual and reproductive health prevention initiatives, both in and out of school. We know girls are frequently accessing these services in school, but as schools close, we need to make sure that there are also community-based solutions for them in this area. And six, no tech or low tech remote learning strategies and services that will reach the most vulnerable girls. In our study population, very few girls were able to successfully engage in the common remote learning initiatives that were prevalent throughout our region. And so we know that those that were able to access remote learning were able to do so because they were no tech or low tech in nature. So in conclusion, we just want to highlight that one, unintended pregnancies, again from transactional sex, is the biggest driver of girls' dropout during the pandemic. But post-pandemic, we find that social stigma surrounding teen pregnancy and motherhood is the biggest factor that will keep girls from returning to school. And then third, girls' needs are multifaceted and really require holistic support. Community-driven organizations that are situated on the ground are often best positioned to provide this kind of support. So we want to thank you all for being here today to learn from girls and the findings of this study. We encourage you all to read the full report. I believe there's a link in the chat to that report. And we're happy to answer any questions that you may have.
Thank you, Brenda and Obrin, for that powerful presentation. Amplify Girls is focused on implementing and championing localization. This is why we were deliberate in conducting in-country dissemination to localize our research findings, policy recommendations, and call to action. We follow the lead of our partner organizations, and I'm very happy to introduce 4 of our partners who led in the in-country disseminations in Rwanda, Tanzania, Uganda, and Kenya. Today, they submit to us recommendations, action points, and general feeling from the country situations and disseminations. A brief introduction of our panelists. We have Maria Omare, CEO, Vision Foundation, Kenya. Monica Nyiraguhabwa, Executive Director of the Girl Up Initiative, Uganda. Detiva Mukamusonera, Executive Director for Comera in Rwanda. And lastly, Esther Happy Mariki, who's the Executive Director of the Girls Foundation of Tanzania. Starting with you, Maria, coming fresh off dissemination and country conversations in Kenya, what came forward from the community-driven organizations with this research, and what are you hoping to see moving forward in girls' education?
Thank you so much, Anika, for the question. From the Kenya dissemination, it was very clear and there was consensus that investing in girls' education is the most effective and beneficial way towards development. We had excellent representation from government actors such as Ministry of Education, the Nairobi City County. We had different youth leaders, community-driven organizations, and people who are really invested in ensuring that girls succeed. We had also representation from teachers, and it was evident that there was a role in boys when it comes to supporting girls' education, and this it was recommended to be done in a way that does not further compromise girls' education, from a preventative approach than just waiting for a girl to drop out because of early pregnancy. And what we also saw was that there was a need to involve parents further, especially in providing support to a girl who has dropped out of school. How do we engage families? How do we engage parent groups? How do we engage the girl also to support them with psychosocial support so that they can also be included even after dropping out of school?
Thank you, Maria, for those very creative insights. Monica, in your dissemination, a lot of the participants talked about localizing interventions. What do you view as the pathway to resourcing these localized interventions for girls' holistic education?
Thank you, Anika. So I think in terms of my view and coming from the learnings, it's very clear that for us to be able to resource all these interventions is that we need to work in coalitions, because you find that so many organizations do not have like a best fit of what maybe funders would like. But in terms of resourcing local ideas, it's important that we work in collectives, we work in coalitions, so that together we strengthen the loose ends, we build capacities of these organizations so that we address the barriers that hinder direct funding to these solutions that we have created at the grassroots. So definitely what is key is that we can't continue working alone, but we need to work in collectives. We need to work as a team and have ideas and issues that we, spearhead as a group, so that our solutions, our ideas, our thoughts are heard.
Hmm. Hmm. Exactly. Those are very creative insights. Localizing girls' education and resourcing is key to achieving holistic girls' education. Now, turning over to Detiva, Rwanda has been cognizant in mainstreaming girls' education, but there's still a lot of work to do for teen mothers. Please take us through what happens when a girl gets pregnant in Rwanda, especially in the context of COVID 19. And is there a teenage pregnancy crisis after the lockdown in March?
Uh, Thank you, Anika. So in Rwanda, there is the issue of teenage pregnancy, uh, like elsewhere. Uh, According to the official statistics, uh, in 4 years, we have 98,347 teenagers that gave birth. And the number kept on rising from 2016, 17, and up to date. So the issue is there, and it is seen, and we are seeing, like, due to the pandemic, it's going even to be higher, from our experience on the ground, as we see as an organization that works with teen mothers, that as an organization that works with adolescent girls. So when a girl gets pregnant in Rwanda when she's in school, she's not offended if she's able to continue in school. She can continue to be in school. No one chase her out. But again, with the cultural beliefs, the cultural norms, the shame that she feels, mostly she gets out of the school. But whenever she gave birth and the parents agree to stay with the child, she can be able to go back to school. But we have seen that that shame within the culture, and then the perspective around the teenage pregnancy always hinders girls to feel comfortable go back to school. So that's how I see it, and that's what I can say about it. Thank you.
Mm, mm. Totally. Very serious calls there. When you look at them, the negative community perception, where in other instances we'd call it social stigma, and also our research bringing it forward that stigma is one of the biggest barriers for girls to re-enter school. Just the loss of hope within the community. And this has really taken root in Tanzania. I think a lot of us have been privy to the conversations that I've been having in Tanzania. Esther Happy is here with us from the Girls Foundation of Tanzania. Esther Happy, Tanzania has previously expelled girls for getting pregnant and has laws criminalizing teenage pregnancy. Now, with the swearing in of a new president, is it a new dawn for Tanzania? What was the response of the community based partners in Tanzania to the findings? And are you hoping to take this forward, in agitating for different laws and handling of pregnant girls?
Thank you, Anika. We Tanzanians are very proud to have a woman leading us, and we all hope that a lot of changes, a lot of good things are going to happen, knowing that women's heart beats from the right. We all know that. And so we have all these feelings that we are going to have a lot of changes and hope to all these girls. Yes, in the past we had this kind of policy which was really stressful for young girls who got pregnancies. And now that we have our mother, Honorable Samia Suluhu Hassan, who is really confident that she's going to do a lot around that. And through her Minister of Education, Honorable Joyce Ndalichako, we had her talking about allowing girls going back to school. It was in May this year, which is a very huge thing they did this year after taking on the leadership. Even though the call was to allow the pregnant girl to go back through informal education, that is a qualifying test, and then after passing the exams, then they can join the formal education. But still, we are hoping that this is a very, very good step. We acknowledge that as the people who are advocating for girls' rights, we really acknowledge that effort. But again, knowing that these qualifying tests are places where they are providing qualifying tests is not available throughout the country and it's not affordable for everyone, we are still calling on to the re-entry police to the formal education because yes, we expect those who are in the rural areas are the ones who are affected more than others in the urban because the education around the SRH is still very low in the rural areas, but the teachers also are not available to teach SRH in the schools. Now those areas where there's no enough support around that is the same area where they don't have areas where they can get the qualifying tests. So for us, we are still hoping that they will go one more step ahead of that, think of the police, and again, think of ways that they will call upon the re-entry police, being clear that girls will be able to be allowed to the formal education. And for those who will be able to go to the informal education, that will be good. But for those who will not be able to join, then the police to be clear that they can join the formal education around their areas. And with the dissemination launch we did last week, we had a rich feedback from the government authorities, the people who attended, the district education officers, the parents, the head of the schools, everyone calling upon the entry police, but also calling on the government to provide the SRI, the sexual reproductive health education in schools, training parents, and also capacitating the teachers to be able to help those girls who are dropping out of school because we had a lot of cases that girls are suffering even after getting pregnant, after dropping out of school. So they had a lot of issues that they want us to keep on talking and explaining to the government, knowing that our good president, who is making everyone proud in Tanzania, is going to take step around that and help us to fulfill these girls' dreams.
Thank you very much, Esther Happy, for those quite enlightening interventions that are set to roll out in Tanzania. We are hopeful it is the launch of a new dawn that girls will not have to drop out of school due to teenage pregnancy. And a lot of work is cut out for the civil society organizations and community driven organizations in Tanzania, because they are the ones who receive these girls who face so much stigma, not only from society, but also from, their homes as well, and from their relatives and family. Now, just wrapping up this session, I would just like to come back to you, Monica, and look at what would be your recommendations unique to your country to funders and government towards providing access to holistic girls' education.
So the message is civil society, community-driven organizations can't work alone. We need to collaborate, especially if we are to bring the policies or the evidence that we gathered into practice. We can't stay with this evidence alone. We need to work with governments. We need to work with funders to realize where the funding need is, to realize what are the emerging needs, so that we are operating from a point of accurate knowledge, information with figures that we've been able to gather, especially in the areas of girls' education. So definitely my take home is we need to work together and just to appreciate the new findings, the new research, so that together we can influence policy, but based on accurate data. Thank you.
Thank you, Monica. A huge, strong call over there to include all stakeholders in this conversation. The girls' education conversation is not just for the Ministry of Education, it's not just for schools, but it involves the whole ecosystem of funders, governments, ministries of education, parents, and the society, to get girls back to school. Moving on to Dativa, what would you say would be your recommendation in handling girls who get pregnant in Rwanda?
Thank you so much. So, I would recommend to have a corrective uh, joint action first with parents, because these parents needs to be educated and talked to on how to be responsible to the girls, to their girls who get pregnant, and be more supportive, so that they don't stigmatize them, so that they don't put shame on the girls, so that they fear to go back to school. So it would be a collaborative or a joint action from the civil societies, from the parents, from the communities, together with the government. I know my government is working hard on sensitization of the community on how to take care of those girls, and even doing awareness campaigns, putting places like Isange One Stop Center, where a girl who get violence or get any issue on a teenage pregnancy can go to, and she gets support in terms of health and other issues. But it should be a continuing activity at all the levels, not only at the community level, even at the government level, even at the school level. It has to be a joint
Mhm.
effort, so that we support these young women to go beyond what happened to them, and they be able to continue their studies as other kids.
Mhm. Thank you very much, Dativa. Quite a strong call there for combined efforts towards destigmatization and elevating negative community perceptions towards teenagers who experience teenage pregnancy. A strong call to action from this research. One of the key messages that came out is that in order to get girls back to school, we must collectively talk about stigmatization of girls who fall pregnant. It is not a conversation for one actor, as Dativa has said, but all of us together instituting a national conversation. Winding up with Esther Happy, coming to Tanzania, we know that Tanzania has a lot of work to do in terms of not only creating a re-entry policy, but also repealing the laws that are currently in place, um, criminalizing teenage pregnancy. What would be your message to funders? How should this process be supported?
Thank you, Anika. That is well said because, as you have seen, as you have heard from our feedback, it is still a huge thing to take. But again, for the funders and mostly the government, because sometimes some of the funders may go through the government, we have one call that we expect them to support. Like yes, the police, it's a role of the government, but again, we have these community-based organizations, the CDOs, who are working closely with the schools, who are supporting parents, some of the parents with the income generative activities, trying to help the young mothers, the young teenagers who are pregnant, who are giving birth, who are suffering from different kind of abuse and stigma. So we have these organizations out here who are working very hard, sometimes without any support from any authority. They need support from the funders, resources that will help them amplify this voice that these girls need help. Yes, we need the change of policy, but we need to show the government and everyone that the girls are suffering, not only for the dropout of school, but there's so many other things. Girls are committing suicide. Parents are divorcing just out of this. There's so many things going on, but these organizations in the grassroots are the one working very hard to keep on talking about this, to educate parents, to talk about the support to these young girls, and even to create some of the centers for these qualifying tests so that the girls will go back to education through informal education. So we are calling upon the funders to be able to support the grassroots organizations' efforts, but also showing the government that through that the government will be able to see actually what is impacting the girls from dropping out of school, and yet the importance of that policy of the girls going back to school through a formal system, not only through an informal, which yes, we are appreciating, but still there's a huge task for us to do as civil society organizations to be able to support them, but with the support of the funders and the government as well. Thank you, Aniko.
Right, Esther Happy, you couldn't be more spot on. The issues of teenage pregnancy are not black and white. They are multi-layered, intersectional, and they are cutting across all sectors of the family setup. And this calls for funders again and again to give community-driven organizations direct and unrestricted funding. Because when a girl goes to a community-driven organizations, apart from the trauma she's undergone, there are issues and layers of rehoming and reschooling this girl that are restricted when we take the model of restricted funding, towards community driven organizations. So thank you, Esther Happy. Quite a strong call there. I move on now to Maria, looking at, the conversations. Kenya has been this country that has the policies in place. It has the most progressive reentry policy, a menstrual health policy in place, but still the conversation on teenage pregnancy is not mainstreamed. We still have girls dropping out. What are we missing? What is your recommendation for both funders and government to alleviate this crisis?
Thank you so much, Anika. I feel like there needs to be more awareness about these policies, even at the grassroots, because the policies are great given, but there is not much that has been done when it comes to the dissemination of these policies at grassroots level. With more awareness within the communities, we could see more uptake in terms of the implementation of these policies. So I recommend for there to be more sensitization and awareness about the existing policy frameworks, even within grassroots organizations. And I also feel like there is need to increase investment in grassroots organizations to provide holistic support for girls who dropped out of education, such as psychosocial support, mental health support. There needs to be investments within households, because really it is only possible for a girl to succeed in learning if the whole community supports her and her needs.
Right, right. Emphasis there on the community driven organizations and interventions to ensure that a girl does not suffer further loss of hope and, dashing of her dreams and further violence to her emotional well being as a result of teenage pregnancy. I'm going to thank my esteemed panel for this very informative conversation about voices from the grassroots, your policy recommendations from the communities, and what you see as interventions. Strong call to actions there to both government and funders. I hope you're listening.
Our vision is to see a fully inclusive society where young people and children with disabilities can thrive.
Kile ambacho nilisikia vibaya wakati niliacha shule ni kwa sababu sikutimiza ndoto zangu, na walimu ambao tulikuwa na huyo wakati hawakuwa wanaelewa mambo ya ulemavu.
Kuna wenzangu wale walemavu, wale wenye walikuwa naenda therapy, na tangu corona ianze mahali pa therapy pakafungwa juu hakuna vile wanaweza enda. Sasa wamerudi nyuma kabisa.
Nilikuwa na changamoto ya vitabu ambazo zenye zingetumika kwa revision kunisaidia kurevise kwa kitu fulani, si kupata kwa sababu shule hatuitikiwi kuzibeba.
Talking about education, one problem that I observed for children with disability, access to school was a big challenge. For a child with physical disability, doing like 2 kilometers every morning or evening going to that day school is not an easy task.
Mimi ningependa tu anipatie peace and love. Hakuna kitu yenye niko nayo different kupitia wao isipokuwa tu kala ya ngozi peke yake.
Mimi matarajio yangu kama msasi ni ile asike kenye mwalimu anamfundisha, na ile mafundisho ya mwalimu aishika akuje kumsaidia kesho. Hiyo ndio ilikuwa tunatarajia.
Let nobody stop you. Let nothing stop you. Move and move until you are there.
So that was just a video from the Action Foundation. COVID-19 unearthed existing inequalities in access to education opportunities for girls with disabilities. During the pandemic, the barriers that girls with disabilities faced have increased, and they continue to increase and multiply. Such barriers include different levels to access, that is access to quality education, retention, and transition to tertiary levels of education. These barriers range from physical accessibility, cultural, attitudinal, systematic, financial, technological, to policy, amongst other barriers. The World Health Organization and the World Bank estimate that in some countries, having a disability doubles the chance of never having to enroll in school. And an estimated 1 out of 3 in school children have a disability. So in partnership with the Urgent Action Fund and Amplify Girls, the Action Foundation filmed the documentary that you've just seen on the barriers to education for girls with disabilities. Pertinent calls to action for girls with disabilities are implement policies to ensure retention and transition rate for girls with disabilities, increase access to psychosocial support, remove barriers to education, and enhance teacher effectiveness. So I hope that we all have learned that within supporting girls to go back to school, let us all pay special attention to girls with disabilities. I'd like to thank my dear panelists from panel 1. Your voices from the community and grassroots organizations are a wake-up call to everyone on this call. And we are grateful for joining us and sharing your stories. To our audience, please remember to tweet. Our hashtags today are COVID-19 Girls Barriers Report, Raise Your Hand, and GES 2021. I hope that you will all join us at the GES Summit at the end of this month. We are also reading all your questions in the question and answer chat box, and the Amplify team is at hand to answer all your questions. You can direct your questions at a particular panelist and they will be sure to respond. We are all online. So now I would like to move to the final session of this launch, a high-level panel with key stakeholders in resourcing girls' education. We recognize that everyone must work together in order to move the needle for adolescent girls. We have received apologies from one of our panelists, Verlaine Dean, but we will move ahead with Dennis and Christine, who are here today with us. Dennis is the localization advisor for childcare, and Christine McConnell is the acting lead and early childhood development specialist at the Global Partnership for Education. So I'm going to start with you, Christine. The plight of young mothers is devastating, and there are not a lot of conversations happening right now on how to get them back to school. So, what is GPE asking governments to do specifically towards access to girls' holistic education?
Great. Thank you so much, Anika. And let me first start off by saying, thank you so much for the very rich piece of research and for gathering this panel today. It's really an honor to be here. So globally, we know that the pandemic has been devastating to the education sector, threatening to reverse the precarious progress that has been made towards gender equality in recent decades. 132 million girls were out of school before COVID, and in many countries, only a small portion of girls that enter primary school will complete secondary school. As a global community, the scale of the impact on the pandemic on girls and their increased risk of school dropout and re-entry challenges, particularly to the girls that become pregnant, is daunting. What I really appreciated about your research was the opportunity to give a voice to the girls on the ground about their personal struggles and the complexity of these challenges. I also really appreciated your work gave voice to the proposed solutions from these vulnerable girls themselves, what their own needs were, and what type of support would be most valuable. So your first question was, what was GPE asking governments to do? First of all, introduction to GPE. So core to the Global Partnership for Education is a shared commitment to work together with partners to really give every girl and boy the opportunity to learn. GPE mobilizes partners and funds to help 90 partner countries transform their education systems and deliver quality learning to more girls and boys, especially those who are marginalized. And as many of you know, GPE is now implementing its new 5-year strategy, which hardwires gender equality into all areas of our work, and it aims to accelerate access, learning outcomes, and gender equality through inclusive education systems fit for the 21st century. So what are we asking governments to do? In our new strategy, GPE will support countries to systematically identify and address barriers to education that affect boys and girls differently. Many of these were ones that you referenced in your report: gender-based violence, teen pregnancy, early marriage, limited access to remote learning. So depending on the country and the context, this might include things like more disaggregated data, systems, gender responsive planning, more gender sensitive learning materials and teacher training, resources for menstrual hygiene, more community engagement and awareness campaigns, etc. But we know that identifying the correct barriers is a critical first step to being able to. So GPE country governments and their local education groups will need to identify these barriers correctly using both data and the experience of women and girls. And here's where I think your report will be very useful for the representative countries involved. Especially because we know that understanding the correct barriers also means that, really acknowledging the gendered social norms behind them. So for pregnant girls, that has been so far discussed today, we know that it may not just be a reentry policy, or one at least on paper, or a lack of childcare alone that's keeping these teenage moms from returning, but rather the large social stigma behind allowing these girls the opportunities to return to school. So without acknowledging the social stigma at individual, school, community, and national levels, the correct barriers cannot be acted upon. So apart from assessing these barriers, we're asking GPE countries to identify how different stakeholders and different GPE mechanisms will support gender equality. One new opportunity is the Girls Education Accelerator, which is where we have additional financing to address girls' education challenges. In the third, we're lagging behind the most. And lastly, we're also asking governments and their local education groups to adapt and learn through different diagnostics, more disaggregated data, and really targeted learning on the different impacts on policy on both girls and boys so that they correct along those. This will require acting on global and local evidence, as well as integrating the role of civil society to lead on gender equality at the country level. So nevertheless, we know that there's more work to do. So as a partnership, we will continue to advocate for getting girls back into school and completing 12 years of quality education. But in light of COVID's impact on education, we know there's so much more to do together. GPE can and will do more. GP or gender equality is hardwired throughout our strategic plan, and a successful replenishment coming soon can help us all reach these ambitions to achieve gender equality both within and through education. Thank you.
Right. Quite a lot of interventions that GP is coming up, and we hope to see you all, of course, at the Global Summit for Education, by GPE, and we are keen to see, not only how the replenishment is done, but how it is spent. And I think we'll be circling back to that just shortly. But moving on to Dennis, Dennis, having launched localization as a key program of childcare, how do we influence the funder or stroke philanthropist conversations to invest more in localized approaches and interventions towards girls' education and community-driven organizations interventions?
Thank you, Anika. As you've just stated, localization is really shifting the power from the different international organizations to the local and national organizations. And really, localization is looking at how do we then leverage on the different experiences that national and local organizations are having. In my preamble, before I now answer your question, I just want to state some few things. One, what is it that we know globally and also nationally and locally? We know that locally led programming is innovative. We know that locally led programming is also cost effective. We know that locally led programming is also smarter, and to some extent, we also know that locally led approaches is sustainable. So one of the things that we need to start now talking about is how do we see the power, especially to the INGOs and also the different aspects, and working in symbiotic organizations. So some of the key things that we need to look at is that when you talk about systemic changes, there are usually different levels of systemic changes. And on these levels, we talk about under the first level, which is the structural changes, we talk about the policies. So that's the policies. The second aspect we talk about are the practices. And one of the things that on the practices, I would also like to probably request the different participants who are here. We need to document some of the best practices of operationalizing localization. This is because this is something that we are in discussion on, and we have different approaches. Each partner has their own approaches, but which approach has been proven to be working. So we need to have a lot of documentation on some of these best practices that are happening. As an organization, we've done some research in Sierra Leone and also in Ethiopia, and we will be doing some research also in Kenya, just to document some of these practices, and you can find them in our website. The other bit is that we need to look at the relations and connections. We know that localization is not quite new phenomena, but we've not had a good opportunity to discuss about it. So it's important to have these discussions on localization. It's important to have conversation on localization at the local level and at the country level. And I will request that because I know different countries are having these discussions need to be also driven by national and local actors. Of course, in collaboration with the donors and also the INGOs. In some countries, you find local and national actors are leading the discussions. In some, we find that it's either the UN body or the NGOs that are leading the discussion. Now, the other key important thing is to under the under the systemic change is what we call the mentor models. And these I would request that we really need to have movements at the national and local organizations that are really discussing about localizations. We know for systemic changes, you really require a movement. So a movement is very, very important so that we can be able to engage on this aspect. The other discussion that we are having is also how do we also support women-centered organization and women-led organization. So this is also another opportunity that we will be engaging with. Thank you so much.
Thank you so much, Dennis. Quite creative insights there when we look at uh, really centering community-driven organizations in the localization conversation. We've had chapters of INGOs, creating national chapters and calling this localization, but is this effective? And I'll just come back to you on that. But first, Christine, in your opinion, have multilateral spaces prioritized resourcing girls' education enough? And in what way, in your opinion?
Great. Thank you, Anika. Thank you for this really pertinent question today. So, in my opinion, I really think that this has been a growing area of prioritization, particularly in the past, 15, 10 years. But really, I think in the past 3, 4, 5 years, really has it become a top priority, I think, amongst the multilateral community and the global community writ large, that we need to prioritize girls' education. With the threats to funding education overall due to the pandemic, and the financial fallout from the pandemic, I think it's time, right? We're making that call even louder. Like, please do not give up on education. We need that financing, and we need that financing to work for girls, to work for the most marginalized. So I think, what does it need to do? I think it's a couple things. I think as a global community, we need to make, the money that we have work better for girls, work better for the most marginalized girls. So this is done in a couple ways. I've seen that we've moved, in recent years, this progress from having a more equity focused agenda to thinking more about equality. So even just knowing that if we have some of the gender parity indicators right, that doesn't mean that equality is achieved, and it's really working at that deeper systemic level. As I mentioned before, it's about getting those barriers right. It's about digging deep and making sure that you're getting those barriers right. So you can have examples, in STEM or digital access, or you can make resources available, but if you're not getting those barriers right, it doesn't mean that the most marginalized girls are able to reach them, and it is going to make a difference in their lives. So we're really trying to work hard on, making that money work, but making sure that, it's working to really unlock some of these core barriers. I think the other piece is really that, moving ahead and thinking about having a gender transformative education system that is not really just making that, achieving gender equality within the education system and making sure that, girls are learning and they're learning well and, achieving quality learning, but really making sure that the education itself is helping to break down some of these harmful gender norms and stereotypes. And that, we're helping the rest of society by really tackling this at the education level. So, on that question about financing, just lastly, that, at GP, we have this new Girls Education Accelerator that we're really excited about. And it's great to see some of the donor interest in financing this. I think really speaks well to, how this is a growing area of prioritization. But just as I mentioned before, there's so much more we still need to do as a global community. Thank you.
Right. And as I was saying earlier, with Dennis, so many INGOs and philanthropies are now saying that they're focusing on localization, right? That they're pushing money towards the grassroots and the community-driven organizations. But now noting that this is your field and you pioneering this huge program focused on this area, what would successful localization practices look like?
I will say first, just to note that there's a difference between locally driven and locally led. And sometimes locally driven is not locally led. And that's why I was very keen to say that we need programs to be locally led and locally owned. Our current system we've been having is locally led, and locally led. Sorry, we've been having a locally driven. So, but we really need to have it locally led and locally owned. When you talk about the different aspects of engagement, we need to look at the three facets. So first is we need to have the programs that are locally owned. We need to have programs that are locally driven, so that we can be able then to ensure that there is sustainability in the project and the work that we are doing. Yeah.
Great. Um, Thank you so much for such interesting insights, learning about the Girls Accelerator Program with GPE and what really localization looks like. But just before I let you go, I just have a concluding question. After the review of this research conducted in collaboration with the community-driven organizations, having seen what this research has said, what would be your call to action towards the global community in holistic girls education? I'm going to start with you, Kristen.
Thank you. Great question. I mean, my immediate response, right, is to get this research, to get these voices of girls and their needs and their proposed solutions into the hands of policymakers. So making sure that that voice is driven, it reaches the local education groups, it reaches national level policymakers who are kind of unpacking these themselves, and making policy decisions moving forward. I really want to make sure that we're bridging, not only this global level advocacy and local research, but really bridging that to the national level.
Right. Dennis, what would be your call to action?
I think for me, when you talk about the girls' education, and based on the research that you've just presented, this is a clear indication that really the world we need to move to we need to operationalize localization, because it's very clear that the community-driven organizations are actually doing tremendous work, and more investment need to be driven towards those organizations. So I will talk about four things. One, we need to continue strengthening the capacity of these organizations, because then these organizations, they are the ones with these girls, and they are the ones who are actually engaging with the girls on a day-to-day level. The second thing is that we need to provide a platform to amplify the voices of these community-driven organizations, community-driven organizations. The third one, we need to look at our funding and resourcing. We need to, based on the World Humanitarian Summit, which actually, and the Grand Bargain Agreement, that organizations need to increase their funding to national and local organizations, to a tune of 25%. So there is need to also um, fund this organization, or increase the funding that we are giving to this organization. The last bit that I will say is that there is need to redefine the partnership approach that we have been engaging with these organizations. The partnership approach need not to be on a contractual basis. We need to look at long-term partnership. We need not to look at each other from from a, 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 um, uh, from an implementer and a non-NGO or a donor perspective. We need to ensure that we elevate them also to the discussion tables on policy issues, and also on the decision-making table of the project and the project design and implementation. Thank you.
Right. Thank you so much, Dennis and Christine. Those were really great insights, and we know that we have gotten a lot. And I'm sure your social media handles will be put in the chat, and people can engage more to find out about implementing localization and resourcing girls' education. And also, please follow GPE on Twitter and across all socials to be able to learn more about what GP is doing in replenishing this money. We are going to be on your case, of course, Christine, on how we are using this money. And just before we close out the session, we as Amplify Girls also use this research to put out a global call to action to the world. And we just want to present it right now in this video.
Research is just the beginning. We must also ensure that these recommendations are implemented. Let's change how global development is done and listen to adolescent girls and the powerful community-driven organizations that support them. First and foremost, we believe that donors should shift funding practices to prioritize direct and unrestricted funding of girl-serving community-driven organizations. Right now, in order to get girls back into school, they need funding to pay school fees, provide materials, and support families. They are on the front lines during COVID-19 and most certainly beyond. Number two, reentry policies for pregnant girls are essential to ensure that they have a pathway to return to school. Several countries have specific reentry policies, but if they do not, then they should certainly have one in place. Number three, policies are great, but we must also collectively mobilize national dialogues on destigmatization of pregnant girls' reentry to school. This is not just about the girl, it is about her family, the community, and countries changing perceptions. Finally, we also recommend a localized mapping of girl-serving, community-driven organizations as central stakeholders in girls' education.
Ladies and gentlemen, we have come to the tail end of our research launch in partnership with the Global Partnership for Education. We look forward to seeing you all at the Global Education Summit on July 28th to 29th in London and the UK. Amplify Girls would like to heartily thank our partners, the community driven organizations at the grassroots who have made this research possible. We also thank our panelists, our researchers, and our global stakeholders who have taken the time to join us, as well as GPE for giving us this platform to present our Research as a Side event and ahead of the Global Education Summit. Please enjoy the video below as we wind up, and we thank you so much for joining us. We have now concluded the research launch for understanding the barriers to girls' return. Thank you very much for joining us. You may now leave at your pleasure.